talk about the difference between antihistamines and mast cell stabilizers. Antihistamines are a great therapeutic tool by blocking H1 and H2 receptors to help you feel less symptoms of histamine. But if your mast cells are still producing a lot of histamine, you still have lots of histamine floating around your system and activating other inflammatory markers and other signs of inflammation as well. So when patients are taking antihistamines and are still having symptoms, that's oftentimes when it makes sense to move on to stabilizing the mast cells to actually produce less histamine. There's lots of things that stabilize mast cells. Supplementally, things like vitamin C and quercetin are great tools. They just have to be dosed appropriately. I find many supplemental products don't contain high enough doses to actually stabilize mast cells. So it takes a pretty hefty dose of vitamin C and quercetin, both, in order to stabilize the mast cells and prevent degranulation and release of histamine. I love both of these tools. They both have other added benefits, like vitamin C is great antioxidant, great for the immune system. Quercetin does a lot for the gut and for healing leaky gut and like strengthening those tight junctions in the gut. That being said, a lot of patients cannot tolerate the dose of vitamin C that's required to stabilize mast cells. And it ends up being a lot of capsules a day in order to get to therapeutic dose. So medication options that stabilize mast cells, my two favorites are going to be ketotifen, which is more of a systemic mast cell stabilizer, and cromolyn sodium, which works more so by the tissues that it can touch. So if you're having more systemic symptoms like hives, itching, upper respiratory symptoms, all the symptoms of MCAS, ketotifen might be a better choice for you to get more systemic coverage. If your histamine reactions and responses are more so gut mediated or triggered by foods, cromolyn sodium might be a better choice because the way it works, it's a liquid medication. It coats all the tissues and prevents any mast cell reactions from happening. So the only downside to cromolyn sodium is that it works and then it's gone pretty quickly. So you have to take it multiple times a day versus ketotifen comes in a tablet or a capsule form and oftentimes is taken 1 to 2 times a day.